Okay, so who do you want to look at first, Pablo or Stitch?
We'll go with Pablo if you like.
Okay, I've got both of them pulled up, and I only got a chance to
Hmm.
glance, so I didn't, but
Oh,
I
that's
right
okay.
away I saw how much weight Stitch had lost.
Yeah, he's lost over 100 kilos.
Wow.
Yeah, which the vet's really happy about. And I said, okay, but when is it that I should then be concerned he's too skinny? Um, and she's like, well, not yet. So,
Yeah,
okay.
not yet.
She said, no, she said there's still quite a bit of green grass around at the moment because we're still in spring. She said if he was that skinny kind of maybe through summer, then she'd think about cutting his dose down
Oh,
because it's
okay.
obviously the medication more than probably his feeding. I have reduced a little bit, but not to the extent of him losing kind of 100 kilos. So it's the medication that's helping him. I said,
Absolutely.
oh, I need that medication. Give me some.
I know. They have a pill for
Have
that now.
to try to lose weight. Bless him. Yeah. Mm.
All right, so I'll hit play. Can you see him? I've got Pablo pulled up on the big screen. Can you see it?
Yep.
Okay.
Yep. Yep.
So how is he doing? What's going on with
Oh,
him?
well, he, I'm kind of keen to get your thoughts on this. So, um, I feel like I know that he's progressing slowly, but he seems to kind of be going backwards a little bit. Like the other day, I don't know whether perhaps he ran around that day in the paddock and maybe not feeling great, or I don't know, maybe he's got a touch of laminitis. I don't know, but it was a struggle even to do 20 minutes with him. He didn't want to go forward. His back leg looked quite. I'm kind of taking more notice now of how he steps with his back feet,
Hmm.
and his right hind was quite a bit shorter than the other one in his stride. Um,
I see
but
that.
then again, I don't know. Maybe yeah,
Nope,
maybe it's just me.
I see it in the video. So he's
Uh-huh.
definitely a little shorter with the right hind. He's still pretty
Mhm.
peg-legged with both hind legs, but you can
Yeah.
see a little shorter in the right hind. What's
Mm.
interesting is his neck being long and a little bit more willingness to go forward would tell me that what you're seeing is the more likely a mechanical issue of him
Hmm.
restoring the function to the entire hindquarters, including the hind legs. And
Hmm.
you may either have to do shorter sessions if he's in a little bit of a transition, or hang with him a little bit, give him a bit of a push and see if he can't work through it. Because you've
Yeah.
got him on Equiox, like a pain management, right?
Yeah, he's on one tablet a day.
Okay.
Yeah, he's still on that. And this session wasn't so bad. I mean, we're not speeding around the place. It's still like
No,
snail's
but it
pace, isn't
looks
it? But
nice and steady.
yeah, the session after this, so the one I did on Wednesday, it was just, yeah, pretty bad. And I kind of just got so disheartened. I feel like you know, I thought we were making really good progress. And then I know that it kind of, that it doesn't go linear, does it? And or, in a straight line. But yeah,
Well, and
it was just, I thought, it looked so broken.
the reason you can have that feeling like you're having a big setback is because when you increase the work of the back and the hindquarters and you're restoring function, every time you make an improvement, they almost look worse before they look better again, or they lose a little forward, or you feel like you've had a setback in some way. It's not necessarily a
Yeah.
sign of a true setback. It's like those joints are either flexing more or extending more, or the muscles are working more, or the skeleton is rearranging a little bit. And so
Yeah.
that's why there's peaks and valleys in the process, or that feeling of having a setback. So if he kind of refused to move forward after this session, because I'm looking at this session going, This is pretty good. And I think the stiffness you're seeing in his hind legs is the beginning of his hind legs actually doing their job at resisting his own body
Oh,
weight from falling forward
okay.
because he's not as long and low. And I got to say,
Mm-hmm.
for him, this is a nice forward energy. It's steady. Um, like he's not, he's just got an easy, steady rhythm as he's going in and out of
Oh,
the frame. But every time I see him,
I
he's
didn't
sort
on
of
it.
trucking along.
I didn't realize how I've set the camera because I don't watch them until now, and it's not going to pick him up going along the long side. Bloody hell. Damn
Oh,
it. Sorry. Which
that's
there's quite a
okay.
bit of because I've kind of well I do try to do circles with him, but it's not very successful. So I've kind of changed it up a little bit where we now do when I go around the outside of the arena, I normally pretty well stay on the inside of him for kind of 80% of the time.
Mhm.
And then on the second lap, I then normally do a serpentine. Excuse me. So I kind of mix it up a little bit. And he seems to stay a lot more forward doing that than going on the circle constantly. It's too many stops.
Perfect.
So
Perfect. And
yeah.
I think it might be a delicate balance with him. Every time he starts to fall into a deep long and low, and he kind of starts pulling on the long reins on the straight lines, you can go back and try circles again. But I think as
Hmm.
he's made a small improvement with how he's using his back and hindquarters, suddenly the circles are hard again, and it's going to be easier for him to be on a straight line to integrate that improvement. And it's
Yeah.
looking like I think he looks pretty darn good. He looks like he's on the brink of sort of just having that breakthrough of comfort where you'll start to get more
Mhm.
forward, whether he's on circles or straight lines. And he looks just like
Yeah.
he's kind of quietly content and concentrating. He's not easily distracted.
Yeah.
He's not stopping a whole lot. He's not got his nose dragging in the ground. He doesn't look super heavy on the long reins, and he's got a reasonably steady pace at the walk.
Hmm.
So all of those are signs that his hindquarters are more engaged than they used to be.
Hmm.
And that can
Yeah.
be what the sloggy work you did on the circles might have helped him make some discoveries or some small improvements. It's hard for us to see. So we're
Yeah.
looking kind of at the overall posture and the movement and the attitude because some of these initial changes are going to be either deep inside around the core muscle use and the spine, or they're going to be so
Hmm.
minor that the human eye can't really detect the change. So, but when we
Hmm.
see a steadier rhythm, kind of a long and level-ish neck, and a happy chappy, like cooperative,
Hmm.
calm, not distracted, pretty focused, those are the easier to read signs that he's still on the right track.
Okay.
And
Yeah.
then what you were concerned with was after this session, he started stopping and getting stuck again. And
Yeah.
that
We just had a really bad session.
and so how
Yeah.
often are you working him?
4 days a week, and it was 40 minutes per time. But I have reduced it um, to 30 minutes. So 40 minutes the other day just wasn't working. Had to kind of cut it short.
Okay. And does he get a
Mm.
day off in between or does he have back-to-back days?
I do because I work full time as well, so I just fit it in. So I do Wednesday, Friday, Saturday, Sunday.
Okay, so then just pay attention, because from Wednesday he should be the freshest.
Mm-hmm.
Friday, the next session being Friday, he should be again kind of his freshest. And then when you do Friday, Saturday, Sunday, if he's losing forward on a Saturday or Sunday, I would not worry about it.
So
If
the form of the bad session was a Wednesday.
It was a Wednesday. Okay.
But
So he had
yeah,
had
but he had,
three
oh,
days
sorry, you
off
go.
or 2 days off, and then he lost forward.
Yeah, yeah.
Okay.
He had a bit of a hoon session in the paddock as well, so that could be it.
Oh,
You know.
yeah.
He rounds
Sometimes,
up the other horses. We call it Pablo's training camp.
oh, great.
Yeah, he
Yeah,
pushes them all about.
he might have done himself in then, or he's midway through these changes and he might stiffen up between Sunday and Wednesday. So kind of watch because
Mm,
there's two ways to look at it, and every horse is a little different. Some horses do really well after a day off or a couple days off, and then when they work more days in a row, they just fatigue. And it
hmm
doesn't seem like a lot of work, but as you're, rehabbing them, they can fatigue when they've made some significant changes. If they're
Yeah.
better off by the end of the days in the row, then it's still more of a coordination issue because during the time off, the strongest habit is what he's coming into work with after days off. Does
hmm
that make sense?
Yeah.
And then if he
Yeah.
did have a run around in the pasture, that could have been it, or that could have added to it. So have you had another session since then, since he got really stuck?
No, so no, that was just Wednesday gone. So um, it'll
So
be that. So I won't have.
tomorrow,
I won't. Yeah. Yeah. Tomorrow.
because I just think he looks less downhill. His muscle development is coming along nicely. The the
hmm
fact that he's slow but steady, which for him is a big improvement. And what you might play
Mm,
with is when he goes into a deep long and low, because you're working from the inside, you could put in a half circle or a turn and see if he doesn't
hmm
elevate his neck a little bit during the turn. So even if he
hmm
stops or slows down, if the turn helps him, oops, when he's in a deep long and low, if the turn helps him elevate the long neck upward again, that's how you're reading his engagement
hmm
right now. Does that make sense?
Okay. Yeah. Yeah.
And so
hmm
in this video, with everything you're doing only once, and it was just as you were coming into a turn anyways, only once has he kind of put his nose on the dirt, like really
hmm
gotten into a deeper long and low. For the most
hmm
part, he's not shortening his neck, he's not bending his neck too much left or right, and he's just sort of keeping his head reasonably level to his back. So
Yeah.
that posture is what's indicating that he's maintaining the best hindquarter engagement he can for now. And so the
hmm
stiffness where you might see the right hind leg really struggle because that was the most underused leg. He
hmm
looks more even as the video goes on compared to where he first started. I could see the unevenness on the right hind back at the beginning of the video, and now we're at like 11 and a half minutes, and I'm seeing the hind legs move more
Yeah.
equally.
Mm. Yeah. Warmed up a bit.
So kind of watching his neck use because you're going to see leg stiffness as the hind legs start to restore joint function. That's kind of a given. And his top line still looks really steady to me. There's not a lot of tilting or rolling through the pelvis and the back. That again is
hmm
reflected with the long neck and the more level head. And so
Yeah.
I would maybe play with turns because he could be pretty different day to day at this point. You're putting together the straightness with the engagement. And every bit of an improvement he makes in the use of his hindquarters is going to be a big deal, and you'll have to adjust the training a little bit. So I would kind of
Yeah.
watch as you're working him, even if it's only a few steps here and there. If he puts his nose down on the ground, kind of work into a circle-ish or turn in that moment.
Yeah.
And even if he
Yeah.
stops, but he elevates his neck without shortening it, that's
Hmm.
again the next layer of improvement to the hindquarter engagement.
Okay.
Does that make
Yeah.
sense?
Yeah.
And
So
then,
if he was fully fixed, when he's going around, his head would be slightly elevated. Is that correct? And
yeah,
he'd be
you
able to
can,
go on a circle without stopping.
yeah, you can think of long and level is kind of a long and balanced frame. And there's a sneaky version of them shortening the neck where the posture can look long and level, but they're still
Hmm.
dropping the back. I don't think you have that because
Yeah.
typically they'll go from dropping the back, spend a little bit of time in long and low, which he did.
Hmm.
And the
Yeah.
reason we went to the circles on the long reins was because he was kind of falling apart in long and low. So
Hmm.
that told us we needed more work from the hindquarters for him to get stable. And what I've seen since you started working on the circles, even though we've had to go in and out of working on him based on his ability to move forward, like this whole video, his neck is remaining long, but he's kind of carrying the top of his head at about the same height at his back most of
Hmm.
the time.
Yeah.
And then if he needs more hindquarter engagement at any point, you're going to know that because he's going to shift back into the posture of long and low. Does that make
Yeah.
sense?
Yeah. Yeah. Yeah.
So when they're short-necked and high-headed, that tells us we just need to focus on the left to right balance, which is why you
Hmm.
did the driving behind him for so long. And then
Yeah.
as he got more stable through his spine and pelvis left to right, that
Hmm.
automatically puts them in the posture of long and low.
Hmm.
And so once they're in long and low, he started to lose a little steering. He started kind of pulling on the reins a lot. And so that was him telling us we need to move from long and low towards long and level. And so the long reins on the circle are a very gentle way to start engaging the hindquarters.
Yeah.
And when the hindquarters are doing their job, which is primarily not only pushing forward, but also using the back and hindquarter muscles to resist his own body weight during motion.
Yeah.
So when they're just engaged enough to not completely fall forward with their weight on the front legs, that head and neck elevates to a more level position. And that's
Hmm.
telling you that he's controlling his own body weight during motion much better.
Yeah.
Does that make sense?
Hmm.
So the the front end, and this is a great example, you're not giving him rein restriction like we're taught when we ride to lift the head and neck. It's
Mm.
it's when the hindquarters, so you can think of every pushing stride in order to move, all of his body weight has to move forward, right? Just like us. When we push with our foot, we're pushing all of our body weight forward in order to move. And then what the
Yeah.
braking does, the importance of the back and hindquarter muscles in resistance is as the weight shifts forward in order to move forward, that resistant use of the back and the hindquarter engagement prevents the weight from just going through the body all the way to the front legs.
Yeah.
So when it's not resisted enough because you don't have enough hindquarter engagement, then it goes the force from the hind legs goes through the hindquarter back, succumbs to gravity, goes to the front legs, and that's why you get long and low as a posture.
Hmm.
Does that make
Yeah.
sense?
Yeah.
And as soon as he relaxed his muscles, but he had too much weight on the front legs, he could hardly function. So
Mm.
the left to right balance gives you the muscle length and suppleness. And then the
Yeah.
hindquarter engagement gives him the strength to resist his body weight from landing on the front legs with long muscles. And that's where
Uh-huh.
he's at right now. So it's actually a huge accomplishment that he's very gently getting the coordination we're looking for. Even though this isn't drastic or fantastic,
Uh-huh.
it's like his posture has been pretty consistent this whole video. And only
Uh-huh.
now we're hitting about the 18-minute mark. I'm starting to see his head go lower and lower.
Uh-huh.
Right?
Yeah.
So when he's kind of long and level, carry on with whatever path of travel you're doing because it's working.
Yeah.
When he
Yeah.
starts to go lower and lower with his head and neck, either serpentines or turns or circles or corners are going to help
Yeah.
him re-engage the hind legs or improve the engagement of the hind legs.
Uh-huh.
And
Yeah.
so you can think of it like we tend to think they're engaged, they're straight and they're done, or they're engaged and they're done. And it's not
Yeah.
really that way. It's incremental.
Yeah.
Does that
Okay.
make sense?
Yeah, yeah, it does. I was listening to one of your podcasts, I can't remember which one it was, and um the the conversation was around where so what's your
Debbie.
Deborah, sorry, the friend that you're on there with. She was talking about her horse, how she was wanting them to go long and low. Is that because her horse might have been an extension? Because if it's not ideal, when is it preferred? Is it because they're an extension and that's kind of the
So,
next step?
yeah, they're going to shorten the neck and they're not going to be able to be in long and low spontaneously unless two
Mm-hmm.
things happen. So you can have a horse, any horse that drops their back. The side effect is it causes the barrel to roll side to side. So you lose the straightness left to right as a side effect of dropping the back. Those two things always happen in conjunction. So any
Mm-hmm.
horse that drops the back is also crooked, right? And
Yeah.
very unbalanced left to right. You can also have a horse that's not dropping the back that just has a habit or a pattern of crookedness. That can also be true.
Yeah.
And so if the horse isn't dropping the back but is very crooked, they'll still shorten their neck in some way. And
Mm-hmm.
so I look at any kind of shortening of the neck is it tells me right away I need to stabilize the weight distribution left to right. I need to stabilize the body left to right. And
Mm-hmm.
once you do, it only has to be minimally stable. And what happens is, as the spine and pelvis is more stable laterally, it releases all those shortening contractions along the hindquarter, back, and the neck. And
Yeah.
so they spontaneously lengthen the neck, which is really a reflection of all the soft tissues back to the tail. So the
Mm-hmm.
suppleness comes through the muscles because the skeleton got more stable. That's what released the muscle tension. So then when
Mm-hmm.
they're in long and low, they're not really contracting the muscles at all. They're not resisting gravity. They're not resisting their own body weight. So that's what long and low is. Does that make sense?
Yeah. Yeah. Yeah.
And so then from long and low, it's that breaking and pushing. It's that push and resistance to their own body weight in equal parts that then they're using the same top line muscles, the neck, the back, and the hindquarter, but they're
Yeah.
contracting the muscles in length. And so you
Mm-hmm.
can think of the back lifting, the hindquarter engaging, the long muscle contractions is what resists gravity on the head and neck. So the
Yeah.
hind end lifts the front end. And that coordination is the important part to me because
Mm-hmm.
once they get that coordination, which is like you first have to learn how to ride a bike before you become a really strong athletic bike rider, right?
Mm-hmm.
So there's a coordination of learning how to swim or learning how to ride a bike that is kind of like where he's at. It's a little awkward looking.
Mm-hmm.
Everybody does it different. It's not glamorous. It's kind of slow. But then once you get the coordination, you don't forget how to swim, you don't forget how to ride a bike. And
Yeah.
you
Yeah.
just get better at it. And it's the
Mm-hmm.
coordination that determines the muscle development.
Mm.
So that's why if we don't get the coordination as soon as possible in rehab, then all that exercise is just reinforcing the dysfunction and maybe adding concussion to his problems, like his ring bone, right? But
Yeah.
because of the ring bone, it's like he was very uncomfortable in long and low with the weight on the forehand and no muscle
Mm-hmm.
resistance. But we don't want
Yeah.
him going back to shortening the top line muscles. He's got to get stable enough through the spine and the hindquarters to use that muscle strength in length. And that's what he's doing
Yeah.
this whole video. This whole
Yeah.
video,
Okay.
he's really got a beautiful posture. And then it's not only the posture, but what's confirming it was the like how little he chose to stop in this whole video, which for
Mm.
him is a big deal, right?
Yeah.
And then he's pretty rhythmic in the forward energy, and you're not having to really chase him, correct him, pull on him. He has more
No.
desire to go forward.
Mm-hmm.
So that desire to go forward, which makes our job easier, is a sure sign. It's kind of a confirmation that what we're seeing through the posture is really what we're getting.
Okay.
Does that make
So I should
sense?
not be, yeah, so I should not be too concerned then if we have a bad day.
No, I wouldn't be too, I would pay attention to if it's happening a lot and like just here, we're now sort of at the 25-minute mark and he stopped by the gate and as he went down the
Mm-hmm.
long side, he started going lower and lower with his head. And so this is the part
Mm-hmm.
where with Pablo, you might have to be kind of adaptable that it's a week or 2 weeks of only straight lines. He can't possibly do a circle. And then all of a sudden, the straight lines aren't working and he needs to be back on circles.
Mm.
Does that make
Yeah.
sense?
Yeah. Yeah. Yeah, it does. And what's your thoughts on um when is it that through the rehab program you think, okay, maybe they do need some intervention with vets or not at all?
Oh, no, stay in touch with your vet. Like vets and body workers and good farriers are my best friends because they're going to tell you that you are absolutely on the right track because the coordination, correct balance, and we have to get it correct for the sake of health and well-being. Like
Yeah.
that to me is the most important part, and that's what
Yeah.
rehab is all about. And so,
Oh, sorry, I meant more so, you know how we were talking before around having like a full, there's a vet that I've been recommended from the Murdoch University, um, and they do like the full overview, I suppose, which will cost thousands, which I've
oh
kind of
yeah,
been, yeah, right. I don't really want to go there, but I kind of had in my head, um, if we're still I don't want to say struggling because, we are definitely making progress, but I'm just keen on your thoughts. When is it the time when you think, okay, maybe the progress is not happening, so then we do need to look at like the full review from the vets? But I
I would
prefer not to go there.
say
But what's your thoughts on that one?
what I'm seeing in this video for
Hmm.
Pablo, I would say you don't need a full lameness workup. Like he's doing fine. I don't see any reason to go spend that kind of money.
Good.
If
Yeah.
he if he really shut down the session after this, and
Hmm.
and I sort of like my magic number is 3. I go, I don't know why, but I find if I have 3 really bad sessions in a row with a horse and I don't see any progress and it feels like a regression, or
Hmm.
if a horse is repeating something like 3 times in a row, good or bad, I feel like that's a little more ingrained. It's a deeper
Yeah.
issue, or it's also a sign that they've learned something, right?
Yeah.
So if I want a horse to learn something, I want him to be able to do it 3 times in a row without a hiccup, and that tells me they've kind of got it. And
Hmm.
so if this whole week, like you're saying, he might have had a hoo-ha around the pasture, um, the better he feels, he might have days he just does himself in on a day off because he's has more energy. But what
Yeah.
I'm seeing in this work session, I see no reason to have a lameness workup done. He's fine.
Hmm.
And
Yeah.
and he's comfortable. And but then the stopping to me is always a sign of discomfort.
Mm.
So is he uncomfortable because he had a blowout in the pasture? Is he uncomfortable because he's sore muscularly? Or is he
Hmm.
uncomfortable because there's some lurking lameness issue that we can't see yet? Like,
Hmm.
so I would rule out the first two before I would go spending money on, because that is an expensive rabbit hole. And
Yeah.
I've had lots of clients that have spent huge amounts of money and still come out with the question unanswered and nothing really they can do other than physical
Mm.
therapy, which is what you're doing.
Yeah,
So
that's what I'm curious about, I suppose. Like, even if they do the whole review, what are their options? Like, do they inject, I don't know, wherever they find something?
injections are kind of the number one option, but the only purpose of injections that I see
Hmm.
is if he shut down or was really limping, an injection would break the pain cycle for about, you maybe have a window of 3 months, 6 months, a year if you're lucky.
Hmm.
And in
Yeah.
that time, you have to work the snot out of them to get a change. Because
Yeah.
all an injection does is alleviate pain. That's all it
Yeah.
does.
Yeah.
But
Yeah.
if the pain is generated from musculoskeletal dysfunction, then you're on the
Mm.
track of maintenance injections, which gets really expensive. And
Yeah.
and
Yeah.
it's risky because you're risking not only joint infections with every injection, but you're risking laminitis. And if you already have a
Oh,
horse
okay.
that is prone to laminitis, I would be super careful with injections.
Mm.
I finally found out one of my horses, oops, hang on a second. One of my horses that let me go to Stitch. Or do you have any more questions before I pull up the Stitch video?
Only actually with Pablo.
Yeah,
Um, so
let me see
we
if
don't have
I
to go
can
back to
go
the thing. Fine.
back.
So I've started at the end of a session. I um we park up at the mounting block and I stand up there and he's been really good. So he brings himself right to me. And he stands there, but he does drop. He drops his penis. Is that normal? Like, is it
So
through anxiety or
it's kind of
what's it all
funny.
about?
It's so with the geldings, they all do that because what can I say? Pelvic engagement is pelvic engagement. And
Right.
it's usually a very good sign that you have been working the hindquarters correctly if they hang everything out when you're
Okay.
done, or yeah, yeah.
Yeah, but more so when I take him to the mounting block and I stand up on the mounting block and he waits there and drops every single time. I'm thinking, what is that about? Is
That
it
could
because
just
he's
be
a little bit anxious?
relaxation. No, that can be relaxation.
Okay.
Hmm. Yeah, he's
Okay.
just relaxed, letting it hang.
Yeah,
Yeah.
fair enough. Yeah.
So, and probably because you're not trying to get on him, and if his energy is calm and his ears are on you and he's not, snarky, then it's just a sign that he is getting deeply relaxed within the context of you up on the mounting block, which is a good thing.
Mm-hmm. Yeah.
But yeah, it
Cool.
can be
Oh,
sometimes the geldings will hang it out when you're done working them, especially when you're, re-engaging the hindquarters, or
yeah.
when
Yeah.
they're really
Interesting.
relaxed. It'll just,
Yeah. Yeah.
yeah.
Something else I was going to ask you as well. So a while ago you said for the first time I get on him, I've normally been putting the bare back pad on. I haven't got on his back yet. I've put my leg over, but I haven't sat on him. But
Hmm.
you said definitely do it with the bare back pad as opposed to the saddle. And why was that? What was the,
Just because I know he had the fracture on the right hind coffin bone, but
yeah,
the most delicate part of this horse is still his back. Like
yeah,
the hindquarters have to really be kind of, which he's finally arrived at. Like as we're kind of playing through the video again, you can see how frequently he's long through the neck, but not falling forward.
mm-hmm,
So that right now he has the amount of hindquarter engagement he needs, but he's going to fall into long and low again, which he did towards the end of this same video, because it's not enough to
yeah,
really lift the back yet. He hasn't started to
yeah,
lift the back a lot, right?
yeah,
So his with a saddle, some people say it protects them more, but I think it's more often with a weak back. I think
mm-hmm,
it's more often either too much weight or too much pressure. And
yeah,
so when you get on with just either bareback or with the bareback pad, you're eliminating the saddle as a factor in any response he has, number one. And you
mm-hmm,
you can feel more for yourself. So you know how long to stay on, when to get
mm-hmm,
off, all of those things. You just have more information.
yeah,
And your body weight being balanced isn't going to concentrate pressure. That's why people are opposed to bareback, is the tree of a saddle is designed to dissipate the weight of the rider over a greater surface area, which is always
yeah,
easier on a horse's back. And once
mm-hmm,
he's walking around, like the first dozen rides, once you're sitting on him, getting him to move forward is going to be step two. And
yeah,
then, getting him, like I go, you're pretty safe to ride bareback until you can get on, give leg to go, turn left, turn right, and halt. Like it's not
mm-hmm,
much, right?
yeah, yeah, yeah,
And that's how I start all my young horses, and I start them bareback because if there's any lurking issues that we can't see from the ground, they usually
mm-hmm,
are very obvious to feel as a rider.
yeah,
But if
yeah,
we have
yeah,
too much saddle or if the horse is reacting to the saddle, then we don't
mm-hmm,
get the same information. We don't get the same clarity.
yeah, okay. Yeah, makes sense.
Hmm.
Yeah.
So you're going to probably find this with him. And I would watch like one bad session where he doesn't want to move forward. I wouldn't worry too much about. But if he does it again and
Mm-hmm,
again this same week on his regular
hmm.
schedule, then I would
Yeah.
start to look at what needs to change and either
Mm,
change to the work program or I don't know, something. But
yeah.
that should not, it might happen as a one-off, but it shouldn't become his new normal again.
No,
Does that
okay.
make
Yeah.
sense?
Yeah, yeah.
Because I really see that he's got this coordination and he may still have a day where he's like, yeah, I just don't feel like it. But that
Mhm.
shouldn't be like three sessions in a row. It shouldn't last for the
Okay.
one whole week, even. You should see him
Yeah.
maybe struggle a little, maybe slow down a little, but not like go back to what
Yeah.
he was once
And
doing.
then, and well, hopefully, I saw him this morning actually hooning around the paddock. So I'm hopefully he's fixed and he's feeling better. Although now he might hurt himself again. But
Exactly.
um, if if he if it is if it does go south, do I just kind of reduce the time of his sessions and
Yeah, work with what he can give you because
yeah.
he if he's doing himself in, like on the good side is I'm looking at this video and his coordination looks really improved and it looks like it's becoming his
Hmm.
new habit. Like he's good at holding it
Hmm.
with a lot less help from you, which is what we're
Yeah.
looking for. And so on the one
Hmm.
side, that's going to give him more energy, which should give us more forward. But on the bad side,
Hmm.
sometimes they overdo it in the pasture because they're not used to managing that much energy. So
Yeah.
if you actually see him running around the pasture a lot and you're getting several
Hmm.
days in a row he doesn't want to work, then I would say he did a number on himself and you're going to have to
Mm.
work him through it. And
Yeah.
hopefully
Yeah.
he doesn't do that, but it's possible.
Yeah. Yeah.
So I would
Yep.
kind of watch that because not
Hmm.
only in theory, but in practice, when I see horses like he's looking in this video, typically you're starting to get to the other side of that mountain of your worst problems. Like
Hmm.
you're going to have him repeat some of his favorite evasive tactics or favorite playlist, but it's not going to have the same punch that it used to have. Like
Yeah.
he might stop a lot, but he won't feel as stuck, or he might get, he might do some of his stuff that he's always done, but it'll feel kind of half-hearted. Like it's
Yeah.
not as intense as it used to be. And
Hmm.
that's what I would expect from him going forward from this point is it'll smell like his past behavior, but it either
Hmm.
won't last as long or it won't be as intense.
Hmm.
Does that
Yeah.
make sense?
Yeah.
And
Yeah.
if
Yeah.
it does get intense, like if he really reverts and he starts to escalate his defensiveness as well as losing the forward movement, then
Hmm.
I would say there's a deeper issue going on. That might warrant a lameness exam. But
Yeah.
if he's not doing that, because typically if it's a pain issue, you're not just going to get them stopping, you're going to get them sort of defending themselves in some way too, really kind of
Yeah.
arguing with you and fighting with you.
Hmm.
Like he did in the past. You know what it's like when he's trying to
Yeah.
defend himself. So if you'll see past behaviors, but not the same energy or intensity behind them. Does
Hmm.
that make sense?
Yeah. Yeah.
Okay.
Yeah.
And
Good.
that's how you know he's humming along, especially if you have good days, bad days.
Yeah.
He's still on
Yeah.
the right
Fingers
track.
crossed.
Keep doing what you're doing.
Hmm. Yeah. Good. Good.
But I'm like this video, I'm thrilled with how he looks. I just think this is fantastic. And right now he's going to teeter
Oh, good.
between long and level and long and low. And so just watch for
Yeah.
when you need to put in some easy turns, when to kind of play with that so that he doesn't get stuck in because with every incremental improvement in the hindquarter engagement, when he's kind of gone as far as he wants to go that's comfortable for now, he'll quit moving forward on the
Hmm.
circles, but he'll move forward on the straight lines. And then when
Yeah.
he needs more engagement on the straight lines, he'll start falling into long and low. But when you put him on a turn, he'll probably maintain forward a little better.
Yeah.
So you can just play with those elements. And then Stitch. Oh, he might be out of camera a
I'm
little.
definitely going to have to position the camera a little bit better. Sorry.
That's okay.
I'll try and put it perhaps in the middle of the arena now.
Yeah. So how long have you been working Stitch again? How long has he been
So
back in
stick
work?
probably about a month. Yeah, a month, maybe a month and a half, and we do 20 minutes 4 times a week. Um, yeah, poor Stitchy. He really struggles. He's so Wednesday I did him the other direction, and
Hmm.
he's a little bit worse on the other direction, and he stops a lot. He stops and then he crosses his back legs like this to try and get some
Interesting.
relief, I think. Yeah. So
And
anyway.
are you working more? it looks like you're more behind him, but to the inside a little. Are you trying to work him
Um,
from the inside or from
so
behind?
So I kind of do the same pattern with him as I do Pablo. So we do on the straight lines. Sometimes I'm behind him, sometimes I stand on the inside. Try and stand on the inside more than behind him. I find that sometimes he can do circles, so I stick with him on the circles, but I can't stand still. I have to kind of follow him. I think if I stand still, it's too intense for him and he stops. And then so I do a bit of circles and then I do serpentines. And I think I'm attempting to do a serpentine. He only did a poop.
Ah.
Yeah.
No, that's looking pretty good. I was going to
He's,
say, if he loses forward a lot, you can always, even if it's only for 4 or 5 sessions, go back to where you're just following the rail and walking behind him.
hmm
That's the gentlest version of the long reins.
Okay.
And then you can increase the feel on the reins, like give him a little bit of a substantial rein contact when you're working behind him and following the rail.
hmm
Um, or if you feel like if he's maintaining a pretty steady rhythm without a lot of stopping, then I would start maybe playing and trying more circles.
Okay. Yeah.
But he might need, and he came back to the long reins. It looks like if this is just a month, he's kind of back picking up where you left off.
He's definitely better in the mind. Like previously, and I suppose it was the pain from his laminitis and whatever else he had got going on. Um, and he was always distracted
Yeah.
and quite spooky, and now he's completely different. I've noticed, so prior to now he's never really been focused on me in the arena at all, or maybe if he was for kind of, I don't know, 10 seconds and then he's away with fairies again, but now he's pretty well constantly focused on the job, which is nice. So
Yeah,
that's a
and
huge
that
improvement.
it's an interesting point, and it kind of goes to your question on whether or not to do further lameness exams. Because, like, I had a horse at my barn where normally I can get the horses pretty quiet. I gave her 3 to 5 months of really working with her, and anything that involved standing still, she could get really calm, really soft. But almost anything that involved steady movement, she kept getting easily distracted, really wound up, would get too fast. And
Mhm.
those are signs of defensiveness.
Yeah.
And when I kind of gave her a solid 2 months of like easy lunging, just asking her to walk right on a lunge line, and she was
hmm
blowing up pretty regularly. And that was my indication that something was wrong. And just getting
mm
the vet out because I knew she has known issues in her spine. She has spinal stenosis, but I didn't know if that was bothering her or if there was something
hmm
else. So I had the vet out, and that was when we figured out she had severe liver dysfunction. And
Oh.
so, yeah, so I think personally that the horses always kind of tell us when it's beyond a training or mechanical
hmm
dysfunction issue. It's a pain issue or it's a health issue
Yeah.
because and it's easy, like this was a thoroughbred mare. So even the vet was like, why do you want me to draw blood? And I go, because she isn't calming down. And the vet was
Mm.
like, well, she is a thoroughbred. And I go, but at my barn, they all calm down. So this is
Yeah.
unusual, right?
Yeah.
And with
Yeah.
Stitch, like Pablo was starting to come along faster than Stitch at a certain point. And
Mm.
it was good that you took him in. And I think the vet exams that you got sort of showed the problems they were having and you've resolved them. So whether you have to go down the expensive diagnostic hole, hopefully that's not the case.
Mm.
Hopefully the laminitis, the ring bone, the more mild issues, and the metabolic issues were what was bothering them.
Yeah, yeah. So, Stitch has previously been diagnosed with kissing spine,
Hmm.
um, and his back end was really kind of wobbly, wasn't it? I mean, it still is, but so yeah, whether or not there's still, well, we're only just starting back in the rehab, so of course there's still, but yeah, I think it's just going to be a long, long road with him. I think there's maybe some.
And kissing spine
He's now
isn't,
19 as well.
it's not as scary as people make it out to be. So, one of my
Mhm.
young horses, he was just 3 years old when we found out he had 13 kissing spine. It was,
Oh, wow.
yeah. And he had bucked me off bad. I went sailing. And that's when it was so unlike him. Um, and he kept bucking after I fell off for like 5 minutes.
Yeah.
So
Wow.
that's what a pain issue looks like, right?
Yeah.
And turned out he had 13 kissing spine. And right under the saddle area was where two of them were fusing together. They had been there so long.
Mm.
And he was only a 3-year-old, maybe 4 by
Yeah.
the time we
Wow.
figured it out. So it was
Yeah.
congenital for him. But a lot of times, so the only thing that the vets can really do is inject or do surgery where they shave the bone to make more space. And I
Mm.
was like, no and no. And
Mm.
so that was when I searched around. I luckily found good mentors. And kissing spine is really more of a muscular issue, even though it's a bone-on-bone pain. It's
Mm.
it's when the horse drops the back, all the muscles, you think of it from the back of the head all the way to the tail head is a chain of muscle, tendon, ligament, and fascia. And when
Mm-hmm.
they're under stress, or when we restrict their neck, or when we don't know how to ride, or we don't realize they're dropping the back, that whole chain of soft tissue shortens when the spine goes down. And then it
Mm-hmm.
has the side effect of the left to right rocking, right?
Yeah. Yeah.
So it destabilizes them in so many dimensions. It keeps causing more and more and more muscle shortening, muscle contraction. And it's the
Mm-hmm.
muscles with the spine pushing downward, the dorsal tips of the spine with the muscles shortening are being pulled together. That's what kissing spine is. Does
Yeah.
that make sense?
Yeah. Yeah.
And
Yeah.
so the remedy for that, ironically, with or without surgery, with or without injections, is long and low.
Mm. Yeah.
Long and low allows the muscles to release the tension slowly because by the time they have kissing spine, that shortening contraction has been chronic. And you can't just take
Mm-hmm.
a chronically tight muscle and stretch it without tearing it. So
Yep.
it's, for him, will probably he may need help with the hindquarter engagement because he's pretty wobbly back there. So if he does stay forward on the long reins on a circle and his neck is long, that's a good thing for him to do. That will build him up faster.
Yeah.
But
Yeah.
if he gets stuck in long and low, he's a horse that we want to err on the side of too much time in long and low rather than not enough time in long and low.
Sorry, air on the side, so you don't want him in too much long and low, or
No,
you
you
do?
do. He's
You do.
one,
Sorry, beg
yeah,
your
you
pardon.
do.
Yep.
Because long and low is the only benefit of long and low, and he's a great example. The case of kissing spine is a horse that
Mhm.
has strongly habituated the posture of
Yeah.
extension,
Which he
upside
has.
down,
Yeah.
right?
Yeah.
That to
Hmm.
me is a more damaging imbalanced posture compared to long and low. Neither one is great, right?
Yeah.
But
Yeah.
the
Yeah.
only benefit of coming out of kissing spine into long and low is the change of muscle use. That's it.
Yeah.
That is significant. And
Mm-hmm.
it's the muscle use that it's the release of that shortening contraction, giving the horse time for those muscles to gently elongate that
Mm-hmm.
pulls the top of the spine apart again.
Yeah.
Does that make sense? And if we
Mm-hmm.
ask them to lift the back too much too soon, then they kind of go back into doing what they used to do. So it's a more gradual process, but it's the exact same process you're going through with Pablo is what you're going to
Mm-hmm.
do with Stitch. And how fast or how slow he can do it, which exercises kind of help him the most in the process, you're going to navigate that a lot better now that you have more experience with Pablo and the changes he
Mm-hmm.
went through.
Mm-hmm.
And Stitch
Yeah.
already, like in this video, he's not trying to shorten his neck. He's not trying to get spooky or distracted. He's
Mm.
finally at a place where you're able to really tuck in with the long reins and your guidance and help support a better coordination that's going to develop the
Mm-hmm.
right kind of muscle strength for him.
Yeah.
So, like I said, I would play with it. If he's stopping a lot, make it easier for him somehow.
Mm-hmm.
And even
Yeah.
if you make it easier and he gets a little stuck with his nose in the dirt, don't worry
Mm-hmm.
about that with him, especially for now.
Yeah. Yeah. He's better on this rein than the other way around, which I did Wednesday. I did the other direction, and he was stopping a little bit more.
Okay. And turns
Yeah.
and circles are kind of the most challenging physically for the horses. And going
Mm-hmm.
behind him and following the rail on a straight line is the easiest for them.
Yeah.
It's the
Yeah.
least challenging to their body. So
Yeah.
somewhere between those two uses of the long reins, you can
Mm-hmm.
just watch how he's using his neck. That'll be the clearest indicator.
Yeah.
Um, and then just keep adjusting what you're doing. Kind of ask him,
Mm.
are you more comfortable? If he's stopping a lot, make the work easier somehow. If he's
Yeah.
falling forward with his nose in the dirt a lot, then make the work a little more challenging. But you can play with how much or how little you do that.
Mm-hmm. Yeah. But yeah, he's definitely a happier horse, which is nice.
Yeah.
Less snarly.
So even from where you came from with both of your horses, if you ever saw, because so far I haven't seen it, you've seen little spikes here and there, but really neither one of them has resorted back to the intensity of behavior that I saw when we started.
No, no way.
Yeah.
Definitely not.
And so
Yeah.
if it ever moves back that direction towards how they used to be, that to
Mm-hmm.
me is the clearest indicator of a pain issue, a health
Yeah.
issue. I
Yeah.
go, because once they start making progress like your guys have, even with
Mm-hmm.
ups and downs in the process or little mini cycles of what feels
Mm-hmm.
like a setback, they're
Yeah.
really progressing overall.
Yeah.
And and even if they repeat the same behavior, like I said, it just doesn't have the same kind of oomph behind it.
No. No.
It's like,
I know something I was going to tell you what the vet said when I kind of mentioned, well, she knows I'm doing this program and whatnot. And she kind of said, oh, we Stitch, oh, well, you won't be able to fix him. It's really just a level of maintenance. I thought, oh, that's a bit negative. I
well,
thought,
that is the medical view because it's like there were a lot of issues that they used to send humans in to surgery for sooner than later. And the
mm,
better physical therapy has gotten for people, the more often they're trying to postpone surgery and see if physical therapy helps. And
yeah,
there is no physical therapy for horses other than sending them to do all the different machines that the vets have at these rehab centers. But none of those therapies are changing the coordination.
No,
So kissing
no, go
spine,
straight back into it, wouldn't they?
right, kissing spine, unless it's congenital, like it was with my horse, is usually the result of dysfunctional coordination. So you can't
Mm,
get rid of that problem unless you change the coordination. But there's very few people, trainers like me, that are changing coordination. So most vets think it's unchangeable
yeah,
because it's just
yeah,
not out there that people are learning how to change a horse's coordination. They're
no,
just they do their training and they get
yeah,
the
yeah.
pain relief from the vet. But the veterinary therapies, which are wonderful, I'm not negating it, and they're
Yeah, no,
important.
they've definitely got their spots. Yeah.
But what they won't do is change coordination, change habits of movement.
Mm,
It will not
yeah,
do that, right? So
yeah,
it can do a lot, but it can't do that. And that
yeah.
is where this part of healing or rehabilitation really comes down to how you work the horse every day.
Mm,
And
mm-hmm.
so what
I don't
you're
know.
learning is basically like it's similar to physical therapy for for horses.
Yeah,
That's what you're
and I
doing.
suppose with ridden horses, if there's a really good rider that's balanced, they're probably doing that naturally, aren't they? Without kind of maybe realizing what they're doing. Is that
That
right?
is, yes, I would say super talented riders that it
Yeah.
just came to them naturally.
How they, yeah, and they balance the horse just by riding them correctly.
Yeah, they have an intuitive feel about it. And
Yeah.
that's what really great writers across the board do. Whether they can describe it or teach it is a different matter. But there's a lot of
Yeah.
people that can do it and they're
Hmm.
quite good at it. And then a lot of our training just doesn't take people to that place. You're either
No,
kind of
it doesn't.
born with it or you're not.
Yeah,
And
yeah.
the training should take everybody to that place to make us
Well,
all
it should
look.
be number one, shouldn't it? Really? Like they don't talk much about the horse balance and well, they don't talk about it at all, really.
Well, that's what
In
dressage was supposed to be. The whole
Mm.
discipline of dressage was supposed to be about balance and gymnasticizing and movement and harmony with the rider and invisibility of aids and all of that. And it's just gotten very far away from that ideal.
Yeah, yeah,
But
it's
I mean,
gone.
what I call rehab, I just don't dare call it dressage, but it really is dressage, or it's what
Yeah,
dressage was supposed to be.
yeah, correct movement. Yeah.
Correct
I know what I
movement.
was going to ask you. I was listening to another one of your podcasts, or actually only halfway through it. It's the one where you're talking around therapy horses and how you were saying that, therapy horses, often people buy the ones that, free horses and whatnot, or old horses. But you were saying that it's really important to keep them in a training program. Um, is this what you'd be referring to as a
Mhm.
training program? This
Yes.
type of thing? Yeah,
Yes.
okay.
And I work with a
Yeah.
couple of different people that do equine assisted therapy.
Yeah.
And this is what either the volunteers or the trainers on staff or the owners of the horses,
Yeah.
a lot of them will do the long rein work between their job of therapy,
Mhm.
or they've learned how to ride them because it's like to carry around unbalanced riders as a therapy horse is taxing to the horse.
Oh, totally. Yeah.
And
Yeah.
even to be a lesson horse, it's taxing to have to cope with an unbalanced rider who's just learning. And so if
Mm.
we're not supporting the horse and supporting the correct coordination in between those jobs, then those jobs really take their toll on the horse.
Yeah. Yeah. That makes sense. I was just curious as to what training you were referring to, so I'm glad I'm on that track.
Yeah.
I'm thinking, what, is there something else as well I should be doing? But no,
No,
that's
and the
good.
horses really enjoy it. So when I do clinics or I go to these therapy barns, I'm there working with the staff on how to support the horse's development. And then
Mhm.
I know nothing really about the actual therapy they do.
No.
And actually, one of them just mentioned to me that she went to a symposium in hippotherapy, which is for the physical rehabilitation of riders.
Hmm.
Technically, technically, hippotherapy can only be done on a balanced horse because what you're
Yeah,
doing is you're using the horse to positively influence the coordination of the rider. That's how dynamic it is,
yeah, yeah,
right? And
yeah.
so if we're not using a the good coordination of a rider to influence positively the horse's coordination,
Mm-hmm.
then the horses are being influenced by dysfunctional coordination. So either way, it's dynamic.
Yeah,
And if you're not helping the horse balance, then all those unbalanced riders are it just keeps
yeah,
guiding the horse to more and more dysfunction.
yeah. I can imagine.
And it
Yeah.
doesn't have to be groundwork. It can be, if you have, like I work with one therapy group and we ride the horses. Like I said, don't bother with the
Mm-hmm.
groundwork. They really need the support of being ridden for them to,
So from a balance rider only, though. Yeah.
yes, it has to be an educated rider that's helping the
Mhm.
horses in between the uneducated riders.
Yeah,
Yeah.
yeah,
Or the
yeah,
riders who are just getting their education, I should say.
yeah.
Because they can go, like, you're kind of paying the price for
Mm.
dressage that wasn't really balanced movement with Stitch,
No,
right?
no.
And so learning rehab, it will it it'll make you a better dressage rider if that's what you want to do. And it just depends. But when you learn how to guide the horses there, it's for the horse's benefit. It shouldn't be at the horse's expense.
Mm.
Right?
Yeah.
So if you're the dressage rider, you should be an educated rider, right?
Mm.
But there's a lot of people who go, I want to buy a dressage horse in order to learn dressage. I go, well, you
Mm-hmm.
still have to become an educated rider,
Yeah,
or all the dressage training, all the balance the horse had will fall off because
yeah,
they don't have
yeah.
the support of the coordination of the rider. So, like
Mm-hmm.
hippotherapy just works the other way around. You take a balanced horse and you can take a very dysfunctional human and retrain the human body through the movement of the horse. And
Mm-hmm.
that's all you're learning to do is take a horse that's in trouble and become the balanced rider in order, and even on the ground, using your body to influence their coordination in a positive way.
Yep.
And
Mm-hmm.
so just play with Stitch and see what he can do because
Yeah.
with feeling better, he's wobbly, he's weak, he's lost some muscle as well as some weight, and he's
Mm-hmm.
had a lot of time off, so he's just going to be kind of wobbly. And
Mm-hmm.
so just looking like way back when we were looking at Pablo, who was the original really wobbly one, kind of
Yep.
watching the top of Stitch's back, watching the top of the pelvis, maybe put the bareback pad on him if you want to get that visual of his back. But you're
Yep.
looking for the back and the top of the pelvis to really move less. No matter what the legs are doing, don't worry because you'll
Yep.
get crazy legs as the back is stabilizing.
Yeah, okay. Yeah.
But really watch the top line and watch for the length of the neck. And then if he's carrying his head really low all the time, focus on pelvic engagement. Use the circles. If he's kind of long and level and he's forward, stick with what you're doing
Mm-hmm.
because it'll keep changing. You know what I mean? It's like we can keep
Yeah.
doing the same exercise, but if we're changing coordination, as soon as the horse's posture changes, it tells us where we need to go, add a little more strength to the left-right balance, add a little
Mm-hmm.
more hindquarter engagement, maybe balance out that braking and pushing. Like their choices kind of guide us what we need to focus on next.
Yeah. Yeah.
But I'm happy to see how well he's come back to the long reins.
Yeah. Yeah. He likes it.
Because even though it's weak and wobbly, it's like the posture is not bad. He's trying to lengthen his neck, right?
Mm-hmm.
And you'll even see that crest that they tell you is from fat or being too
Mm-hmm.
fat. Like his neck still has the old arc to it.
Yeah,
And
yeah.
you'll start to see that go away. You'll start to see the top of the mane really flatten out and not
Hmm.
have that little arc to the top of his mane.
Yeah, yeah. So yeah, hopefully, hopefully he comes good.
Yeah, he's off to a great start. And then don't be afraid when they're wobbly like that and a bit weak. Play with how much tension you have on the long reins
Mm,
because sometimes when they're wobbly like that, they'll stop more frequently if they don't feel supported. And when you
mm,
increase the tension on the long reins, if you take a little bit more of a stronger feel, sometimes that is the support they need in the beginning in order to keep going forward even.
yeah, yeah, yeah.
Yeah, because
Sounds
be feeling unstable sometimes can be enough that they go, "Oh, I just can't do it. I'm not stable
yeah,
enough to do it."
yeah, exactly.
Yeah.
So yeah.
And when they're slow, sometimes we're a bit too light on the reins because we want them to go forward. But if they're slow and wobbly,
Mm,
sometimes a little
mm,
bit heavier rein can kind of help them stabilize first, and then that will give you more forward.
hmm. Yeah, yeah.
Okay. Questions? I know you got to get going.
No, all good, thank you.
Oh,
All
good.
good.
Anything you want to clarify with either one, or that we covered a lot. So,
Yeah, we did. We did. Yeah. Yeah, no, it's and I do love our fortnightly sessions because it kind of puts my concerns at ease. Like when I saw Pablo the other day, I thought, oh, that's it. He's just broken. He's never going to be any good.
I
But yeah,
know we
I
do
can
that.
just calm down a bit. Yeah,
Well,
yeah,
and
yeah.
especially with the first horse you take through rehab, it is like an emotional roller coaster. And
It
then,
really is.
yeah, then
Yeah,
you start to get used to it. So by the time Stitch is moving through, you'll be like, oh, yeah, that's just a hiccup. No
yeah,
big deal.
yeah. I just and yeah. I suppose because I've not seen the Pablo hasn't gone all the way through yet, and I feel like we just get stuck in this thing, but we are progressing. I just need
He's
to.
pretty darn close.
Yeah.
Because once I start to see the posture, the movement, and the attitude come together,
Mm.
you're really getting over the biggest hump. Like you're going to transition from slogging for this much progress into
Yes.
more like you'll start to see progress come in more leaps and bounds, and you'll still have setbacks, you'll still have some other stuff come up, but you'll
Yeah.
just start to see it move forward faster.
Yeah. Yeah. That would be nice.
Yeah, so that's what was so exciting about Pablo's video was I'm seeing that
Yeah.
coordination take hold in his body, which is pretty
Oh,
exciting.
good, good, good.
Yeah.
Yay. Yeah. All righty. I better get to work.
Better get to work. All right.
Yeah. Yeah. All right.
Mm.
Well, you have a lovely night, and I'll